now talking about another disorder, that's hypoxia. So in an insufficiency of oxygen reaching the tissues of the body, or in other words, it's a condition of oxygen shortage in the tissue. Hypoxia is of 5 types. Namely, hypoxemic hypoxia, then anemic hypoxia, stagnant hypoxia, histotoxic hypoxia, and metabolic hypoxia. Hypoxemic hypoxia, in this type of hypoxia, the tissues do not have enough oxygen because there is a lack of oxygen in the blood flowing to the tissues. This is an increased mutation rates, a drug efflux protein, insensitivity to various components here. This is decreased cell proliferation rate, oxygen and nutrients, drug permeability, and soluble factors. Talking about hypoxemic hypoxia. Hypoxemic hypoxia can be caused by inadequate breathing as well as other causes. Could be progression of the renal disease, then arthroclerotic plaque, stability, radiotherapy sensitivity, rheumatoid arthritis, inflammatory changes, and so on. Talking about another type of hypoxia, that's anemic hypoxia. In the setting of anemia, low hemoglobin levels result in reduced ability of the blood to carry oxygen that is breathed in. As a result, a diminished supply of the oxygen availability or available to the tissues, and anemia can in turn be caused by many other conditions. Now talking about stagnant hypoxia, here this form of hypoxia is caused by inadequate blood flow, which results in the less oxygen available to the tissues. You can see this part, this is having less oxygen supply to these very tissues, which have turned kind of blackish. Talking about histotoxic hypoxia, students, with histotoxic hypoxia, there is an adequate amount of oxygen inhaled through the lungs and delivered to the tissues, but the tissues, they are unable to use that oxygen that is present, and so this is another condition. Now the question is, what is the reason of histotoxic hypoxia? So less amount of oxygen is delivered to the tissue. Tissues are not able to use adequate oxygen delivered to them. Oxyhemoglobin dissociated rapidly, or is it less oxygen that is diffused in the capillaries by the alveoli? And the answer is B. Tissues are not able to use the adequate oxygen that is even delivered to them. So that is the reason of histotoxic hypoxia. Now talking on next, that is the metabolic hypoxia. As you can see clearly in the picture, metabolic hypoxia occurs when there is more demand for oxygen by the tissues than usual. Metabolic hypoxia, in this, oxygen may be absorbed or transported or used properly by the tissues, but due to conditions that raises metabolism, it is still not enough. So the various issues could be genomic instability, tissue invasion, metastasis, glycolysis, immune evasion, evasion of apoptosis, limitless replicative potential, regulation of the cell proliferation, regulation of the angiogenesis, or is it self-sufficiency in the growth signals? Now talking about metabolic hypoxia, an example of this is sepsis, a serious and overwhelming infection. This one is a normal one, this is hypoxia here. So you can see there's a serious and overwhelming infection. Talking about the symptoms of hypoxia, students, so the signs and symptoms of hypoxia can vary between different people, and by how long the symptoms have been present, we can understand. Some of the symptoms of hypoxia include dizziness or fainting, that is a syncope, and the other is shortness of breath, that is dyspnea. Then some more symptoms are confusion, lethargy, or lack of judgment, or maybe headaches. And some more symptoms are rapid heart rate, that is tachycardia, or elevated respiratory rate, that is tachypnea. So we have now come on to the next question. What is tachycardia? Respiratory arrest, fast heartbeat, slow heartbeat, or is it cardiac malfunctioning? And yes, the answer is tachycardia. Cardia is heart, so fast heartbeat. This is the answer. What is tachycardia? It is fast heartbeat. Another symptoms of hypoxia is like euphoria and sense of well-being. That's also another symptom. Then tingling, warm sensations. Some more symptoms are elevated blood pressure, that's hypertension or lack of coordination. Visual changes such as tunnel vision or elevated red blood cell count. Polycythemia in people with chronic hypoxia. Then a bluish tinge to the lip and extremities, that is the cyanosis.